All right, welcome back, everybody. February is Heart Month, and no one knows that better than Peter Delisle. He's being treated at the Pat and Jim Calhoun Cardiology Center at UConn in Farmington.
Yes, Peter was diagnosed with a condition known as atrial fibrillation, or AFib for short.
Yeah, it's an irregular heart rhythm, which can lead to all different types of problems, and that's why Peter chose the doctors and staff at UConn to help him get his rhythm back. Take a look.
A nice normal rhythm today, my friend.
Music to Peter Delisle's ears, because for the past several years, more so in the past 1.5 to 2 years, Peter was suffering.
Felt like a zombie.
You felt like a zombie?
Yeah, I did. I was awake, but I didn't have the normal functioning and normal level of energy. So I'd just as soon sit down as I would go for a walk.
Okay.
You know, and more often than not, I did sit down. That was the problem.
And that's changed?
Yes, it has.
Good.
In a very positive way.
That's all thanks to Dr. Christopher Pickett and the staff at the Pat and Jim Calhoun Cardiology Center at UConn in Farmington.
So I usually see patients, both general cardiology who might have symptoms like shortness of breath or chest pain or things like that, but also within cardiology we specialize sometimes, and I specialize in seeing patients with arrhythmias, which are electrical abnormalities of the heart, which can manifest in a lot of different ways. Sometimes you might not have any concerning cardiac symptoms, and every now and then people will show up with a stroke, which is one of the worst complications of this very common arrhythmia we manage called atrial fibrillation. But some people can be really debilitated by atrial fibrillation with shortness of breath, fatigue, loss of energy, stamina, and have a lot of sort of negative impacts on their quality of life.
That's Peter, who also had a family history of heart disease.
When I look back at my family history, cardiovascular disease goes back to my great-grandfather.
Right.
One of my biggest fears, truthfully, was my grandfather had a stroke when he was 63 years old.
Wow.
And he lived, but he lost his ability to speak and some of his motor skills as well. And I was probably 8 years old when I saw that for the first time, and then years later my dad had open heart surgery when it was experimental. So it was pretty apparent to me that cardiovascular disease had me in its sights. And so I paid close attention to it, and I'm lucky that I did. And of course, Dr. Pickett helped me kind of gently move toward intervening, and,
right.
and it worked.
So Peter had atrial fibrillation for many years, and one of the things I love managing about atrial fibrillation is there are these very technically sophisticated, fascinating procedures that we do sometimes, but management ranges all the way from that, some of the most technical stuff you can do in medicine, but also you have to incorporate the real fundamentals of life, and so that's, you know, making good lifestyle decisions like eating, weight management, use of alcohol. Alcohol has a very strong impact on this arrhythmia called atrial fibrillation. So you're at both ends of the spectrum in terms of the most basic sort of fundamental things you should do for your health, all the way up to these incredibly sophisticated, complicated procedures that sometimes you step back in and say, oh my God, this is just really amazing, fascinating procedure.
The procedure is called an ablation.
And there's lots of different types of ablation, but this kind of ablation that we do for atrial fibrillation, it's interesting because at the end of the day, we really do not have a firm understanding of the exact mechanism and cause of atrial fibrillation.
Okay.
But we knew there's phenomenon where the sparks, so to speak, that will sort of set off the fire of atrial fibrillation are these mini arrhythmias that come from the veins that actually drain blood from the lungs into the heart. So we isolate those veins electrically so that these impulses that might start out in the lungs and come in through the veins from the lungs to the heart and cause you to go into atrial fibrillation, those impulses are now blocked and can't come into the heart. The standard way for many, many years has been using radiofrequency to burn or cauterize the heart muscle. So burning is using radiofrequency, and that heats up the heart tissue, which destroys its ability to conduct electricity, but it's still there. You don't want to burn a hole in the heart. That's the trick and the challenge of this. So you're burning tissue that's only about 2 to 3 millimeters thick. So you want to burn it just enough so that it stops conducting electricity.
Which is exactly what you want to do.
There's been a lot of evolution in how we do the procedure, and we used to do this with something called fluoroscopy, which is like an X-ray video basically. So there was a fair amount of radiation that the patients and the people doing the procedures would get exposed to. But there's these newer systems called electroanatomic mapping systems, where there are patches put on the chest of the patient, and then they generate an electrical field, and then it's basically GPS inside the heart. You can see where you're moving around with these catheters, where you're doing the ablation, and where you're burning the heart.
Incredible technology here at UConn, and Peter is grateful for it.
Why'd you pick UConn?
Well, you know, again, we had lived outside of Connecticut for a number of years. UConn is very, very highly regarded. My wife and I were both looking for a place where we could both start our medical attendance going forward. We're both UConn grads. It became kind of easy to affiliate with the school associated with it. But having lived in other states, I also know the reputation of the school. And I was particularly interested in being able to come to a teaching hospital because having had other procedures in the past, teaching hospitals have different kinds of approaches to how they treat patients. And so Dr. Pickett has a kind of a wonderful generosity of spirit. And not only did he help me by explaining what this is all about, to the point where I could actually try to make sense out of it, but oftentimes he would have, as part of a consultation, one of his students who are first-class young physicians who are learning about cardiology.
Just an incredible institution. I love it. If you would like more information about the Pat and Jim Cardiology Center at UConn in Farmington, please head to the health.uconn.edu/cardiology.